Good morning. Thank you. It's great to see all these smiling faces out in the crowd today as I get to talk about something that I hold near and dear to my heart. As Seth said, my name is Xavier. I've been in healthcare almost 15 years. And if you can imagine a disaster or emergency dealing with healthcare, I've probably been somewhere in the middle of it. Probably shouldn't have been sometimes, but I was. And so today I kind of want to talk about a framework that I've been building over the last 15 years about leaders and what it means to be a leader and how you can step into leadership opportunities. And so, what I want to do right now is I want to kind of take you guys on a ride, probably a little bit of a roller coaster with me, and take you guys back to when I first had that leadership opportunity, which was in January 2014 in Atlanta, Georgia. And at that time, I was a young emergency responder, probably a year and a half on the ambulance. And in January, the city was brought to its knees by snow. And not just snow, 3 inches of snow. I wish I had known some of you at that time. And so I'm trying to get back to my station at this time. And by the way, I know how to drive on snow now. But at that time, I was slipping and sliding, and I slid into a Waffle House. And so we get back to the station, and our station chief talks about, we need you guys to stay over. The city is completely locked down. Our highways are a parking lot now. Thousands are stranded across the entire city. Some of the 911 calls that came in that stood with me is a young lady and her infant was stranded on I-75. She had ran out of gasoline, and so she had no way to put heat into the car. An elderly man called 911 because his daughter was supposed to pick up his insulin and he hadn't had it in 24 hours. And she couldn't make it to him because the city was we were locked. School gymnasiums became 24/7 daycares because parents couldn't get there, and grocery stores became shelters. All in 6 hours from 3 inches of snow. And so that night, it taught me a lot. And one of the first things it taught me is my station chief said, we need some help. We need some team leads. I stood up, put me in, coach. I'm ready. A year and a half doing 911 and non-emergency in Georgia. I'm ready to go. I wasn't. She sent me, I thought I was going to be helping do 911 calls, and that's what I was trained for. She sent me to a hospital with 2 other trucks. The hospital needed to decompress the medical and surgical floor so that they can move people from the ED up to beds and the people who needed to come from outside into the ED. And so I get there and I have these other 2 trucks, and mind you, all of the seasoned paramedics decide to go home. So it's just all young people who are really gung-ho about this right now. And I get there and I'm in charge, and I hear my station chief tells me to do one thing, dispatch tells me to do another. I have a hospital administrator yelling at us and an ED director who's also yelling at us, and none of them make sense. This person wants me to do this person wants me to do that, this person wants to do that. And the thing that I learned is that leaders don't just stand tall in storms. They rise to the occasions. And they tend to bring solutions and systems with them. I had no solution and I had no system, but I did stand. And so that experience started to get to me after everything was over, that I needed to dive deeper into what it meant to be a leader. I needed to dive deeper into what it meant to lead people. And so over the years, I have really dug into what it means to be a leader. What did it mean to lead people? What are the traits that you need to do that? And so what we're dealing with right now across this country is unprecedented uncertainty. We're seeing more complex and severe medical emergencies and disasters every other month. We're talking about the political polarization of words. We're talking about the eroding trust in healthcare. We're talking about emerging diseases like COVID and Mpox. We're talking about vaccine preventable diseases that we thought long ago were done are back now. In fact, I just worked the last 40 days, not taking a day off along with our staff because we had a measles outbreak in Mesa County, the first one in 20 years. So what I've learned over the 15 years is something I like to call the RISE framework. So this is a framework that I have built through scars, through trying times, through waking up at 3, 4 a.m. in the morning, through working through Saturdays, weekends, and holidays. And I want to talk to you guys today about that framework because I truly believe that our next generation of leaders can benefit from this framework and benefit from that experience. So you have to be resilient. You have to be able to adapt and bounce back under pressure. It is one of the key foundations of being a leader. And one of the things that I have built my entire career on is I am a uniter. I can integrate and bring people together. So integration is the future of what we need to do to plan for these complex diseases and disasters that we're having to deal with. And as I told you guys earlier, I had no strategy at Snowpocalypse, and it showed, but we made it through because I was resilient. And the last pillar that has really hit me, and it came to me during COVID, was sustainability. Legacy is important. A lot of us wants to leave a legacy. And I used to think of legacy as I want to be remembered, but that's not the case. I want what I do to outlive when I'm gone. I want the trainings and the teachings and the systems that I build to pass on to the next generation so that they can build on it too. All right. So between Snowpocalypse, because I had no Colorado friends at the time, and 2018 when Hurricane Michael came, I spent 4 years diving into leadership. What does it mean to be a leader? What does it mean to lead? What does it truly mean to have people follow you and take that responsibility? And so one of the things I found out about being resilient is not just bouncing back, but you have to be adaptable. There is no response, there is no medical emergency, there is no emergency that I've dealt with in the last 15 years where I didn't have to change on day 2 and change on day 5. Same thing goes for our measles response that we just had here. We went in thinking we knew a lot about what was going on with measles, and then 48 hours later, we had to change completely our response. We went in thinking we could do this with 8 to 10 people, and I ended up having to have almost 24 to 30 people run a response here in Mesa County. And so that leadership and being able to adapt to whatever is coming towards you is probably the first piece of the framework and resilience. So then, in 2019, in Georgia, we started to have a surge of Hep A cases in some jails. Interesting scenario, asking nurses who are not normally going into jails, I need you to go into jails and help us do some treatment and testing. And so one of the things that I learned a year later was the second piece of the framework, which was integration. We need people to help. And so I was able to get community nurses. I was able to get supplies from EMS and the hospital to be able to go in and do this treatment. And resilience isn't siloed, it is a collective. And I remember going back and a muscle memory hit me in 2012 when I was working in a shelter during Hurricane Sandy up north. I had never in my life seen housing, transportation, human services, and nonprofits work together to take care of the whole person. And so if you ask anybody on my team right now or anybody that I've worked with, that is what we embody as me as a leader. We integrate across the spectrum with everybody. So another piece that I want to talk about is strategy. In 2015, a year after Snowpocalypse, which in my head, I was Jordan in the prime when I did that, but probably more like it, I was Shaq at the end of the career. And I'm sitting in the back of the briefing room, listening to our lead tell us what we're going to do, and I'm hearing the briefing and I'm thinking, they have a plan for everything we do, where we eat, where we sleep, how we're going to get in there. And that level of strategy has never hit me since that time frame. And so the last thing I want to talk to you guys about is sustainability. In 2023, I had moved on to a state executive position. And at that time, Central Georgia got hit with unprecedented tornadoes. 5 in an hour. It ripped through Spalding County, which is an hour south of me. It was one of my counties when I was a local health director. And so I knew the emergency manager really well. So I called him and I said, Glenn, you good? Everything's all right? And it was very quiet for a second. And all Glenn said was help. And I was like, okay, what's going on? What do you need? And he said, I didn't know. And so my head was like, this is what I do. So I told my wife, who's in the back, who yelled at me, and drove down during the storm to help. And I got there and I pulled Glenn aside and I said, hey, we know how to do this. We've trained. We have muscle memory. We have tools in our toolbox. I said, Glenn, what's the first thing we do? He said, what do you mean? I said, what's the first priority that we've always known to do? And Glenn said, we save lives. What's the second priority? Property, utilities, making sure our water isn't contaminated. What's the third priority? Control and command. I walked out of the room and I said, let's go. And so what I learned about sustainability is I had been a year away from my team at this point. And so I called the regional health director and I said, hey, listen, I called in, he asked for help, I'm here. She granted me the authority to be a deputy director to make decisions on behalf of the region. Cool. I call my team, all hands on deck. I say, hey, we got to set up 3 shelters and I need nurses. The specialist that I left in charge and they hadn't hired a director yet, she said, they called, my nickname is Zay. She said, Zay, we're good. I said, what are you talking about? She said, soon as you left, we got together and we talked about something we needed. And I said, well, what's that? We need mass casualty and shelter trailers spread across our region. And I said, okay, do we have them? Yeah, we got 14. You did 14 trailers in 1 year? And so now we have these trailers where we can set up a shelter anywhere in our region in less than an hour. And so I'm sitting here thinking that I need to step in and that I need to do this and that I need to do that. But what has really come to fruition is that sustainability piece that I put together worked. It has outlived me. They have built on it and made it better. So let's talk about the big kahuna, which is COVID. Because prior to COVID, I didn't have the sustainability piece. Sustainability came during COVID, and it came because we thought we had plans. We thought that we had things put together, and we didn't. And that's one of the huge mistakes that going into COVID is that we thought we knew exactly where we wanted to be, what we wanted to do, and the plans that we had all crashed. And so we had to make anew. We had to rebuild. And so that's where the sustainability piece truly came from the framework. So again, this is the framework that I've been working on for 15 years. This is how I mentor. This is who I talk to my people about. My staff knows that this is how I'm building them. And so the last thing that I want to leave you with is that as leaders, we don't have to be perfect, no matter what your mother says. We just have to rise to the occasion when the occasion is there. I tell you now that commitment for us is that we show up every day. Not that we show up with an answer, but we're willing to commit to finding it. So thank you guys so much for listening to me. I appreciate it. I hope you guys have a great day.